Hi everyone, today we are going to be looking at the occurrence of retained surgical items or RSIs in the operating theatre and what role the perioperative nursing staff have in this process. Hi everyone, today we're going to begin by developing an understanding of what exactly is a retained surgical item. We are then going to analyse the data on the occurrence of these events. Then we will look at what factors contribute to an increased risk of RSIs. And finally, we'll look at identifying how RSIs can be prevented. By the conclusion of this session, you should be well educated about the nature of this topic and what you can do as a perioperative nurse to prevent this from occurring in the operating theatres. A retained surgical item is any item, such as a sponge or surgical instrument, that is inadvertently left within the body cavity during or after closing. This incident poses a great risk to any patient involved and is entirely avoidable with attention to detail. When a surgical item is retained, it is considered to be one of 10 sentinel events in Australia. A sentinel event is an unanticipated event resulting in death or serious harm to the patient. It is essential to consider that any item that is introduced into the surgical field can potentially go missing if the appropriate steps are not taken. Any patient who is affected by an RSI can face a number of physical, emotional, and financial consequences, which can develop over days, months, or years after the initial procedure has taken place. This can be debilitating for an individual and can even result in fatalities. However, this does not only affect the patient, but can also negatively impact the surgeon, the hospital, and other staff. It can cause a number of medico-legal issues, can impact on a facility's reputation, could risk some staff's unemployment prospects, and can also be emotionally draining for anyone involved, as they may feel extremely guilty about these events. For those who are unfortunate enough to have had an instrument left inside their body cavity, there are a number of potential adverse outcomes. Studies show that 69% will require reoperation, 43% will require readmission or an extended hospital stay. Sepsis and infection will affect 43%. Another 15% may be affected by a fistula or bowel obstruction. 7% may experience visceral perforation, and 2% of cases will result in death. Okay, so let's look at the stats. Between 2013 and 2014, there were 9.7 incidences of RSIs per 100,000 cases. This had increased from the year before, which recorded a rate of 8.6 cases according to the Australian Institute of Health and Welfare. Instruments are most likely to be left behind in the abdomen, pelvis, vagina and chest, as they are more often involved in greater blood loss and a larger cavity. A 2005 study of 7 Sydney hospitals revealed that over a 3-year period, there were 140 RSI errors reported. 64% of these were linked to count errors and 36% were a lost item. Looking at Table 1, the incidence of RSIs in a New Zealand study revealed that in most years there was a minimum of 40 adverse events in this category. However, trends suggest that it was significantly lower in 2008 and 2009, and again in 2016 and 2017. These events are occurring not only in Australia, but all around the world. Despite best efforts, this sentinel event is a recurring issue on an international scale. As per this graph by the Australian Institute of Health and Welfare, Poland was considered to have the lowest rate at 0.4 incidences per 100,000 discharges, and Switzerland had the highest rate at 12 cases. So this surgical complication is entirely preventable and has occurred in many cases around the world. In this case, a 34-year-old lady presented to the emergency department symptomatic with a high temperature and increasing abdominal pain. An X-ray was ordered, which revealed a large abdominal abscess which required immediate surgery. A large tumour was resected in theatre, which was filled with a large amount of pus and a surgical sponge from a caesarean section she had 9 years prior. This woman was fortunate enough to have no further complications. However, this error could have been potentially life-threatening. Okay, so this is what was extracted from the patient 9 years after the initial surgery. So image 1 shows the abscess that it was encapsulated in, and the second image shows the actual surgical sponge that was left inside the body cavity. It was interesting enough to discover that 300 mils of pus was released, and all cultures came back negative. In another case, a 36-year-old woman underwent an operation on a cyst in her liver. 3 years after the surgery, she excreted a part of the surgical forceps in her stool. She was then admitted to the hospital with reports of abdominal and pelvic pain. An abdominal x-ray revealed a metallic instrument at the L5 vertebrae. The patient was then reoperated on to remove the item to remove the other half of the corroded black forceps. So image 3 is an x-ray image of a retained forceps. Image 4 is the element that was extruded in the patient's stool, and image 5 was the part that was retrieved during surgery. The patient recovered fully, but sued the doctor in the hospital who were responsible for the operation. There are many factors that influence the level of risk and the potential for a surgical sponge or instrument to be left behind after surgery. Those procedures which are considered an emergency pose a greater risk, as this also comes with added pressure and time constraints to the surgical team. Also, if there's a rapid change in either the patient's condition, which requires immediate treatment, or there is a change in the course of the operation, this will make it more difficult to keep track of the utensils introduced into the surgical field and may contribute to any counting errors. Any patient who has a high BMI also has a higher risk of an RSI, as there is a typically larger space within the body cavity to misplace an instrument. Other factors such as time constraints, poor communication, lack of concentration, and other distractions also play a role in increasing risk to patients. As I mentioned earlier, this event is entirely preventable and needs to be addressed to reduce incidences all over the world. It is a team responsibility to ensure every item is accounted for throughout the procedure. In an ideal world, a positive work environment will enable anyone who notices a discrepancy in the count to speak up so that everyone can search for the missing instrument. However, I understand that this is not always the case. Despite a number of challenges, it is important to verbalize any concerns, as everyone is accountable for this error. By following standardized policy and procedures such as the surgical safety checklist or timeout, this will minimize errors, as it is a useful way to keep track. Minimizing distractions such as turning off music, reducing any talk that isn't related to the case will also help. By anticipating potential challenges and changes, this will prepare the team to ensure all equipment is ready to go in case of an adverse event. So to summarise, the occurrence of RSIs is completely avoidable. The perioperative nurse plays an important role in avoiding these adverse events by advocating for their patient and speaking up if there are any discrepancies or concerns. By paying close attention to detail in order to avoid any mistakes. And finally, by problem solving in case of an incident or change in a patient condition to reduce the risk of errors.